President-elect Joe Biden is set to unveil a multi-pronged strategy this evening in an effort to put the country on a path towards recovering from the coronavirus pandemic. His plan centers on a mass vaccination campaign and improved coordination among all levels of government. This comes as the country faces its deadliest wave of the pandemic. The surging death rates are largely being fueled by hotspots in California and Arizona. According to California public health data, one person dies every 6 minutes from COVID-19. In Arizona, state officials have recorded the highest number of new coronavirus cases per capita in the country. So for more on this, let us bring in Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University Bloomberg School of Public Health. Thank you so much for joining us, Doctor. We're getting some pretty grim numbers out of the CDC. The forecast that they're giving us is that 90,000 Americans could die of COVID-19 in the next 3 weeks. What is happening? Why are the next 3 weeks so challenging?
The next 3 weeks are going to be challenging because we have record numbers of people in the hospital, and we've seen basically a surge on top of a surge on top of a surge when you look at Thanksgiving, Christmas, New Year's, and that accumulates a lot of cases, and a lot of people are going to end up in the hospital. So we are going to have some dark days ahead of us, and we're going to see deaths go up. That shouldn't be a surprise to people, and it's going to take some time before that stabilizes, and it will stabilize as the vaccine rollout continues and our most vulnerable populations get vaccinated, such as nursing home residents.
Doctor, a Texas trauma surgeon says those who've had COVID-19 symptoms show severe chest x-rays every time, scarring and congestion. What is that? Is that a cause of the coronavirus? And how does that impact people after they've recovered from it?
So when someone recovers from pneumonia, whether it's a bacterial pneumonia or a viral pneumonia, it's going to take some time for their chest x-rays to improve. Chest x-rays lag your clinical improvement. So you may be better, but your chest x-ray still looks bad. And we know that people with COVID-19 can get severe pneumonia. And some of that pneumonia will lead to damage to the lungs that will take time to heal. And some of it may be permanent. And it could affect people's ability to perform their activities of daily living for some period of time, especially if they had a severe case. They were in an ICU, on a ventilator. Those people are going to take months and maybe years to get back to their baseline health status. So it's important that we think about the long-term consequences of COVID-19. And this is why it's not something that you can blow off. This isn't something you want to have, because even if you survive, you still may be left with some severe complications that make it very hard for you to go back to your baseline functioning.
So according to the CDC, coronavirus infections among children, teens, and young adults rose steadily from September through mid-December, but still, pretty rare in these age groups, these younger people. But the data really parallels the virus's trajectory when it comes to older adults in the U.S. population. So, what does this mean? Is it that sort of for every young person that contracts the virus, we're going to see a lot more older people contracting the virus, or how do you kind of interpret the data?
Well, in general, we find that younger people can be infected. They're less likely to have severe disease, less likely to need hospitalization, but they also tend to be more risk tolerant. So they're more likely to be exposed to the virus. And we've definitely seen that in high school students and college students, where there's been increases in cases. So I do think that what holds still from the very beginning is that younger people tend to do okay with this disease for the most part, whereas older people are much more likely to have severe disease. And younger people, especially very young school-age children, K through 12 or even younger than that, are less likely to drive the spread of the virus. And that's why a lot of us have been advocating from the beginning about opening schools. But it is a challenge. And I do think that as we get more testing, we are going to find more children and more younger people involved, because early on we weren't testing people unless they had severe disease or were at the hospital. And by definition, those younger people were not showing up because they weren't that sick, so they weren't able to be tested. So I do think we're getting a more full picture of the full spread of this virus throughout the population and all the demographic groups.
So, Doctor, as you know, the coronavirus ravaged the country last year, but cases of seasonal flu dropped drastically compared to the 2019 flu season. I've seen a lot of people on social media scratching their heads about this. What does this tell us about the flu, the transmissibility of the flu compared to COVID-19, and perhaps the impact of current health protocols when it comes to combating the flu?
So the flu is not COVID-19, despite some people trying to think that they're very similar. The flu is not nearly as contagious as COVID-19 is. So even the kind of mediocre job we're doing with social distancing, masking, and hand washing, that was enough, coupled with the vaccine and coupled with some pre-existing immunity, to basically silence the flu this season. This shows you just how contagious COVID-19 is, how resilient it is, how it can really break through all of those barriers that influenza is unable to do. And that's why I think there was such an alarm over this virus, because we've got a population that has no immunity. Up until just a few weeks ago, we had no vaccines, and this can spread in a way that flu can't, because there's no immunity, no vaccines, nothing really to stop it. So that's why it was so important to emphasize the social distancing, and it will continue to be so important to emphasize those common sense measures.
So there's a model developed by Emory University and Penn State University about COVID-19, and it suggests that, if COVID-19 continues to circulate in the general population and most people are exposed to it from childhood, it might just end up being added to the list of common colds. Can you explain that to us? Because right now it seems a little more dangerous than a common cold.
So you have to remember that coronaviruses are a big family. This is the 7th human coronavirus we've discovered, and 4 of those coronaviruses cause about 25% of our common colds, and they are, in general, very mild. What we're seeing is that this virus, after it gets through the population, after it infects a lot of the elderly, the vulnerable populations, and we get a vaccine, we get some pre-existing immunity, it's likely to become probably the 5th seasonal coronavirus and cause common colds. It will still be able to cause severe disease in immunocompromised people and the elderly, but it will become less of a public health problem. Nobody was around when the other coronaviruses jumped into humans, and there is some speculation that in 1889, the last flu pandemic of the 19th century, that it might have been a coronavirus pandemic, which then tamed as population immunity rose. So I do think that this is going to be something that becomes what's called endemic. It's going to be with us. It's not going to be a public health emergency. It's not going to be a 5-alarm fire anymore, but it is something we're going to be coping with basically forever. It's established itself in the human population.
All right, Dr. Adalja, thank you very much. We appreciate it.
Thank you.